Okay, thank you very much for coming to us for this varicocele operation. It's really honor for us to have a patient from, you live in United States, right?
Yes.
Which part?
Los Angeles.
Los Angeles, California, right?
Yes.
Okay, and what's your profession?
I work ramp service at the Los Angeles airport.
Airport, in the airport. Is it such a heavy business? I mean, you lift heavy things?
I used to do that. I've been working like 13 years now.
13 years, yeah.
So I'm lead position right now, so
Yeah.
I don't have to touch.
How many years leading position?
Lead position probably 60 leads every day.
Uh,
We have 2,000 employees.
I mean, how many years you are in the leading
Oh, lead position I'm about 3 years.
3, okay, then 10 years you were a
Yeah.
hard worker,
Yeah.
lifting things, such things.
Yeah.
Okay, so varicocele disease is a genetic problem, I think. But if you are lifting heavy things, if you stand in the standing up position all the time, the risk increases. And you had a really significant varicocele in both sides, left side and right side. How did you discover that you have such a disease?
When I went for infertility treatment,
Yeah.
I got tested that low sperm count.
Yeah.
And it was below 2 million coming up on average.
Yeah.
Then the doctor told me that I could do that or I go to IVF.
Yeah.
Either one. But it sounds like they don't want me to do that. Because they say you can go to IVF with 2 million.
Yeah.
You don't have to, but
Yeah, actually, gynecologists, IVF doctors,
Yeah.
they never believe varicocele is working for fertility. But we have many patients, no need for IVF. IVF is a little more difficult for women, and it is costly, of course.
yeah.
Do you have insurance? Does your insurance covers IVF treatments?
No.
And how much IVF in the United States? Do you have an idea?
Oh, IVF is over 20,000 probably per
Okay.
cycle.
Okay. And does your insurance cover varicocelectomy operation?
It covers part of it, not all of it. I have to pay a little bit.
Do you know the price in US?
No, not the total price.
Yeah, I think it's around 10,000. I think like this. So, how did you find us? How did you recognize that I am doing this a little different kind
Yes,
of operation?
I was researching it because I tested low sperm count about 2 years ago.
Yeah.
So I was Googling and YouTube. I found different doctors. I checked what procedure they go, and I found you a little bit different.
Yeah.
And I talked some other countries' doctor too,
Yeah.
but I was not satisfied really.
Yeah.
Because they're almost saying the same thing the American doctor was saying.
Yeah.
Yeah, and I know I have kind of severe.
Yes.
Because I was feeling weak too. And I think I have to do it right. So
Yeah, you be weak in life, weak in sexual desires,
Yeah.
such things, and also in daily activities. If you have some decrease in testosterone level, it affects everything, not only your sexual.
another thing, when I was trying to go long walk or
Yeah.
something, I had start pain.
Yeah.
After I couldn't do it.
In the testicle, you have it.
Testicle.
In the left side mainly? Okay.
Yes.
Because you have a very large extreme vein on the left side,
Yeah.
and again a significant vein in the right side too. So you find me, and what's my story? I was using this Doppler device. No, first I put videos in all of the procedure I do, like stone disease, prostate disease, kidney surgeries, such things. And in the YouTube, most of them have too much shots. They watch them, but nobody, very low people come for other disease. But for varicocele, I put a microscopic varicocele surgery maybe 10 years before. Then people come. I couldn't understand why with kidney stone nobody is coming, but with varicocele people are coming. So I understand that this is a very sensitive subject. Everybody is hesitating to trust someone, so they begin to come. When they come more and more, I begin to deal with varicocele more and more. Then by chance I had a Doppler device, ultrasonography, but with Doppler, very high quality machine. So I begin to look like a radiologist to the testicles. This changed my practice because after the operation I do in a normal way. We ligate the vessels. Next day I look like before the operation. I look to your vessels, and now when I look to your vessels, there's nothing. You know, before the procedure, you have big veins in the left side, right side. Now there's only arteries, no big veins. So when I look after the ligation, of course, next day they will not disappear. I see the vessels. Patient says, "Hey doctor, it is looking same." I said, "Of course it will be same. They will disappear by time." Patient says, "Oh, are you sure?" Of course, maybe not 100%, but they will disappear. But today I am 100% sure your veins are not there anymore. So next month, patient came, we look, veins still there. 3 months later, veins still there. They don't disappear in some percentage, maybe 30%. But if they are disappearing in 70%, it is not instantly. Maybe 3 months later, 6 months later, 1 year later, it's very stressful. So I said, okay, let's quit using Doppler because I can't manage fighting with this. So then I said, why? This is a very sophisticated machine showing me everything. Before the operation, I can count how many arteries are there, how many veins, which kind of veins I will see inside. So I talked to my colleagues from vascular surgery. They said, oh, well, at last one urologist came and understand that their procedure is nonsense. I said, oops, what do you say? They said, you have to take out these veins. You can't leave these veins inside. Okay, it's easy. Why not? And I said to them, you are wrong because 70% of the cases, veins disappear by time. They said, okay, but why don't take them instantly, and after the postoperative day 1, you will be healed. And now in your body, recovery begins today. But if we ligated them, they will be filled with blood and they will disappear in 3 months maybe. The recovery will begin 3 months later. So I changed the procedure and I am very happy with taking them out. And for example, embolization. Many patients are coming to me after embolization because embolization only treats the veins in the inner spermatic cord. We call it inner testicular veins, in the internal testicular veins. They treat it nicely, 100%. If there's an abnormal vein, okay, it will fail. But so there are 2 more vein structures: external spermatic veins and gubernacular veins, which is impossible for embolization to reach them. They are outside, they have other origins, they are not connected. So embolization also good, but 70% success rate. Normal varicocele operation, 70% success rate. There is also other reasons why the veins do not disappear. It's long to tell. Now I want to talk about just, can you say, is it possible to come from United States for this operation? And so today is Tuesday, you come here Saturday, right? Saturday evening you arrived. Monday morning, we are a little hurry because I will have a vacation. Sunday morning, I evaluated you, which is a holiday in Turkey, no problem. I love my guests. So Sunday morning, we do the operation.
Yes.
You rested Monday, today is Tuesday. So you come Saturday, Sunday operation, Monday, Tuesday. After 2 days of the operation, second day post-operative, how do you feel?
I had little pain the day of operation Sunday, but today I'm feeling a lot better.
Lot better today.
Yeah.
Do you? When are you leaving back?
I'm trying to leave tomorrow.
Tomorrow.
Evening.
So it's really very short. I really normally recommend wasting here 6 days. 6 days is safer, but you are strong. So it is a little risky. What's the risk? There may be some bleeding after the operation in the scrotum. In last 200 cases, I had only once this bleeding. And if you had the bleeding after the operation, I would immediately see it. And I would put a drainage tube inside. So when we have this drainage, there is nothing to do more. but it will be a longer healing, maybe 2, 3, 4, 5 days for a complete healing. And if the patient spares here 6 days, it's safer. So I recommend sparing 6 days. And do you say it's possible to come from United States for the procedure?
Yes, Turkey is now very accessible, but it's 12-hour flight from Los Angeles.
Yeah, direct flight.
Direct flight, no
Yeah.
stop, yeah. It's a big airport, I know. That's the reason I took the chance. And yeah, it's very easy.
Yeah, you come here easily. You find our my office.
Yeah.
Your hotel is next to the office.
At the airport, you can get a SIM card and get an Uber call. It's easy, very flexible. I didn't see that. I was thinking it could be harder. But
Yeah, I also think I was thinking like this too. So it's easy, nice.
Yeah.
I don't want to organize these transfers, hotels, such things because it is always commission. They will take commissions. If we ask hospital to organize everything, the cost increases too much. But if you do it yourself, it is the cheapest way. I want to keep it as cheap as possible every time because really I don't want to waste money. I want to reach many people all over the world, in many countries. So I try to keep it simple and cheap. So organizing it yourself, transport, hotel is the best way. What's the roughly cost that will all together, flights, hotel, operation? So what's the roughly cost of this?
About $5,000 to $6,000.
$5,000-6,000, including surgery, including travel to United States by plane. So yes, I think so. So the operation cost, it's sometimes forbidden to talk about it in the internet, but you can think like not half of it, maybe 30% of this is operation cost, maybe 30% planes, and the rest is. Do you have some special discount because you work in airport? In the flights?
No, this time I got my tickets.
Okay.
I don't want to waste time. I still have day off because I'm going to take 2 weeks rest.
Okay,
anyway.
this is nice.
Yeah.
This is a good idea.
Yeah.
In the healing is not too much difficult. Of course, you will have pain when you sit down, stand up, when you walk, but these are tolerable as you come here walking. And tomorrow you will go to airplane, and it doesn't bother. It will not bother you too much. But I want you to rest at home at least 1 week. It is enough.
Yeah.
I also ask all my patients how many days you have to rest. The Turkish patient says 5 days.
Okay.
5 days is good, but you will travel. It will be difficult, of course. If you spare 1 week more, it will be better. And for the controls, I will give you a medication to increase the sperm count.
Okay.
And I will ask you to start it 1 month after the procedure.
Okay.
Because the tissues have to get used to the new situation.
Yeah.
Then you will use it 3, maybe 6 months. So unfortunately you have a very decreased sperm count, but you have large veins. So we are expecting a good recovery, good results. So we will use medications too. You can also find them in US, of course, but I have here the ones I use. I will give them anyway. Everything finished, and we will send you to home tomorrow, and you will begin your medications 1 month later. Thank you again for coming. I hope really well done and will work you. We will see in the control visits. I will see. Thank you for coming. Do you have any questions, such things?
No, thank you for your help. I thought it would be much harder, but I feel a lot better now.
Thank you.
Thank you.
Thank you. Thank you very much. Thank you for coming.